So in this session, we discuss inclusion and exclusion criteria and study screening. So remember to engage, like, share, and do subscribe to this channel. Let's go. It's going to be very pertinent for me to give a clear outline of how we are going to roll out our program for today. So first of all, I'm going to start by talking about explaining what is inclusion and exclusion criteria and why are they necessary in systematic reviews. And also, we're going to look at how to develop your inclusion and exclusion criteria using different models. And if you want to know more about some of the models, we've talked about it in our previous videos, so you can go back to previous videos or you can scroll back and see some of the information we've had. And also, we'll talk about some of the other considerations that you can put in while you're formulating your inclusion and exclusion criteria. And we'll have a look at study screening. What do we mean by study screening in systematic review? And we're also going to have some practical steps to performing your study screening, and also how you can record some of these reasons on the Prisma flow diagram. And also we'll look at the duplication, how you can remove duplicates when you've performed your study screening. Trust me, this is going to be a very fantastic session where you would have a very clear understanding of how you can use Excel and Zotero software and some of the critical steps that you need to understand while performing your screening and filtering out undesirable characteristics from your study. So we're also going to have hands-on practical exercises that are very paramount for our session. So here it brings us to our program for today. So if you're looking at this, we have our inclusion and exclusion criteria. So we're going to have numerous examples populated with this. And the idea for these examples is to see that we sync all the parameters for our inclusion and exclusion criteria. And once we're able to dilute these examples, we can now have self-on practice on formulating our own questions and getting it in shape. So the question now is, what is inclusion and exclusion criteria? Somebody might be asking, when we talk about inclusion and exclusion criteria in systematic review, what exactly are we trying to communicate? What do we have in mind? What are we looking to communicate to the audience or the academic community that we are trying to send our systematic review to? So when you look at this picture here, you find out that there are a lot of babies seated down there. So some of them might be maybe different racial color. So who and what attributes do these babies need to have for you to put them into your study consideration or for you to have them studied? So that is what we mean by inclusion and exclusion criteria. So our participants our study, what characteristics do these studies need to have for us to say, oh, we want to really put these studies into consideration? So inclusion criteria are just referred to some of those specific attributes and characteristics or some of those conditions that some of these studies has to meet for them to be included in your systematic review. And they determine which studies are relevant to the research question and should be considered for analysis. So let's assume here you've got a study you want to start, right? So there needs to be some specific characteristics that those studies needs to have for you to include them into your study pool. So but on the course of exclusion criteria is that there could be some conditions or characteristics that disqualify them from being included. So let's say, for example, maybe you want to study the maybe prevalence of type 2 diabetes among adults in a certain population. Now it could be that maybe you want to include type 2 diabetes adults, but then specifically adult type 2 diabetes patients who are co-infected with HIV and AIDS, you wouldn't have to do what include them. So that means there are some specific characteristics of that particular group that you don't want to include. So So just see it as this picture that we have here projected. Now they help to eliminate, so inclusion and exclusion criteria help to eliminate studies that are not relevant, or maybe they are poorly designed or do not meet the scope. So on the course of this session, we'll see other characteristics and other considerations that we need to make while we're pulling out our inclusion and exclusion criteria. So here's a friendly example, very nice image here. So let's say in a study on maybe the effect of physical activity on reducing the risk of cardiovascular diseases. Now, the inclusion criteria may be specific, or they may specify studies on adults aged 40 to 65. Here, we're not just looking at all the population, we are only targeting it at adults that are aged 40 to 65, right? So, whereas the exclusion criteria now, maybe it might actually remember this is just the research question. It's not really talking about adults or thereabout. But now in our inclusion criteria, we say we want it to only focus on this 40 to 65 aged adults. And maybe in our exclusion criteria, we may omit studies that do not have maybe any control group or studies focusing on pediatric population. So we'll have a more clearer example of our inclusion and exclusion criteria in our future examples, right? Using our models. So at least at this point, we're able to understand what our inclusion and exclusion criteria could be while we are performing our research. So now the question is, why are inclusion and exclusion criteria necessary? What makes it imperative in our systematic review process? Why do we need to perform our inclusion and exclusion criteria? So one of the reasons that is focus, right? And relevant. So our inclusion and exclusion criteria just tries to make sure that our research question is well focused and it's quite very relevant. And also transparency. Once we have our inclusion and exclusion criteria, it makes our research transparent, right? We can say this is exactly what we are looking at, and this is what it's expected of us to exclude. So in that situation, we wouldn't have to start including things that are not there or things that are not, we didn't really say at the beginning that this is what we're going to include. Because when you're performing a systematic review, the reviewer is interested in what have you said that you're going to include and exclude. So you have to make it transparent, you have to clearly lay it out, and in that way it's going to reduce bias, so that along the course of you doing it, you wouldn't have to start going out of plan or doing what you're not really, what you didn't state that you're not going to do, right? And that way your evidence is clearly reported. And also our inclusion and exclusion criteria makes it very efficient in the sense that it makes our workflow very easy and smooth. We're able to conduct a very beautiful research and come out with very reliable outcomes because we already have a clear reporting process. And again, it's reproducible, right? So here it's asterisk. Our inclusion and exclusion criteria is necessary. Remember, the point we're discussing is why is our inclusion and exclusion criteria necessary? It's necessary because it makes it reproducible. Means that once another researcher picks up our research and follows the same pattern or the same reporting guideline, we're definitely going to come up with the same outcomes. So that is why one key characteristics of a systematic review is that it has to be reproducible, right? It has to be something that once another person picks it up, the person should be able to come up with the same outcomes. Now the question now is, how can we be able to develop our inclusion and exclusion criteria, right? Now we have diverse methods, models, frameworks that we use in formulating our inclusion criteria and exclusion criteria as well. We can also refer this inclusion and exclusion criteria as what we call eligibility criteria. Right? So it's technically the same thing, eligibility criteria. And that means, let's say, for example, we want to use the first model, which is known as the PICO model. Now, the PICO model stands for Population Intervention Comparison and Outcome. So it's used for quantitative and clinical research oriented questions. So let's say, for example, we want to put our inclusion and exclusion criteria. So in our population, in our model, we'll be interested in who is this population and who is this study about. And is it going to be about adults? Is it going to be about children? Is it going to be about patients? Maybe patients with a specific disease, right? So in our population, we're interested in these participant groups or patient group.
In our intervention, we are looking at what is being done, what type of treatment do we want to include in our inclusion and exclusion criteria. So these are the important information that we really need in our inclusion, particularly when we're using the PICO framework. So also we can also look at what we call the comparison. It's also applicable maybe when we want to put in our eligibility criteria. We could say, oh, these are the type of treatment or alternative intervention that we're interested in our inclusion criteria. Maybe we are going to compare it, maybe in exclusion, any type of treatment group of such is going to be excluded. And outcomes are also very paramount in our eligibility criteria, or what we call our inclusion and exclusion criteria, where we need to note down the results that we are interested in collecting from the papers. Are we interested in improved health? Are we interested in reduced symptoms? Technically, any outcome that happens to be suitable for us, we should include them in our model. And that is what we need to clearly state in our inclusion and exclusion criteria. So here is an example of what we are trying to talk about in our eligibility criteria. Now, for example, we have a research question: does cognitive behavioral therapy improve mental health outcomes for adults with depression? So here in our inclusion criteria now, so we're looking at studies on adults population, right? So our population is studied on adults. For intervention, we're interested in CBT. For comparator group, maybe we're looking at control group receiving no therapy or a different therapy, or maybe placebo. So, maybe we're measuring changes in depression. That's going to be our outcome. So maybe in this situation now, our exclusion criteria now could be maybe studies without a comparison group, or maybe some of those studies that are focusing on children or adolescents. Now, we'll have to also take a look at another model that we identify as the SPIDER framework for our inclusion and exclusion criteria. So in the SPIDER model, SPIDER stands for sample, phenomenon of interest, design, evaluation, and research time. So we've talked about this framework in our when you screw up previous examples. So it's used for both qualitative and mixed method research. So here in our sample, in our inclusion criteria or exclusion, we could be looking at what is this research focused on. Is it among caregivers, patients, healthcare professionals? Phenomenon of interest, what is being studied? Is it experiences or is it behaviors? And in our design, we could be interested in how is this study structured that we want to include. Is it going to be interviews or is it going to be focus groups? And in our evaluation, which is also known as our outcome, what outcome are being measured? Is it satisfaction? Is it coping strategy? So you have to be careful of not confusing your evaluation with your phenomenon of interest, because in your phenomenon of interest, we are interested in what is being studied, whereas here we are interested in what are the outcomes of what has been studied. So in that situation, when you study experience, you might be getting information on what the satisfaction levels and all that. When you study behaviors, you might be getting outcomes on coping strategies. So in our inclusion and exclusion criteria, also we can also be clearly stating on our model what our type of research is. Is it qualitative or is it going to be mixed methods? Now, here is also an example which I would like us to look at. Just have a look on this. Just 1 minute. So have a look on it. So if you look at the SPIDER example that we have here, you'll find out that here we have a question: what are the experiences of healthcare workers? Healthcare workers here becomes the sample, providing care during COVID-19 because phenomenon of interest. But one thing we need to understand is that most times when we're formulating these models, we don't necessarily need to have all the information captured in the research question. And that means in our inclusion and exclusion criteria, that's where we're going to be more detailed about what we want to include and what we want to exclude. So maybe qualitative studies here could be the research type, which is not really captured there, but you just need to you need to figure that out. And focusing on healthcare workers sample, exploring their experiences during COVID-19 is the phenomenon of interest. Using interviews or focus groups as supplement studies, the design is going to be the design. Then the emotional, psychological well-being is the evaluation. So in our exclusion criteria, we don't necessarily need to contrast this, but we need to find out actually specific things that are not that's maybe our research question content, but we are not really interested in it. So that is it. So, but we're going to also show detailed examples from where we've tabulated them. So also we need to look at the PEO framework, which is also another beautiful framework that we use for maybe quantitative studies, or sometimes could be used for quantitative studies depending on the context. And here, in terms of our population, the question, we're trying to do the same thing. Who is involved, right? Exposure, what is the experience, what is the condition? Sometimes we can also use this as a PIO. We can call it the issue of interest. And we have our example here, which is a specific healthcare intervention. Maybe this could be list of maybe people who are living with a chronic illness. And our outcomes here could be maybe a couple of results or the quality of life, coping mechanisms. And here's also another beautiful example here where we are looking at a question, which is what are the experiences of mothers, which is the population who have undergone home birth. So in this scenario, studies focusing on mothers is the population who had home birth exposure and personal experiences and satisfaction is the outcome. So our exclusion criteria here now could be maybe studies on hospital beds or studies that measure only clinical outcomes without exploring personal experiences. That could be. And again, another framework is the PCC framework when we have the population, context, and concept where we use it mostly for scoping reviews. And the same thing happens for the population. We have the concept, which could be the main idea of the subject. And the context is what is being studied in what concept. And it could be the hospital, it could be the community setting, it could be anything, right? And here's a question where we are talking about what is the understanding of mental health among adolescents in school settings. So the concept lineups, the population and context, and the inclusion criteria is stated, right? In that scenario, maybe studies that are examining the concept of mental health could be the concept, adolescents is the population, school environment is the context. And we could also have specific information within the exclusion criteria that we wouldn't really want. So we'll put them in what? In exclusion. So it won't be enough for us to talk about this without looking at some of the other considerations for our inclusion and exclusion criteria and some other considerations that we could put in our table where we'll show a very detailed example. Could be the publication dates. Maybe we could also say, oh, we are not interested in studies that are published maybe earlier than 2010. It could be 2020. It could be whatever year, or all studies published from antiquity, or maybe that by antiquity will mean from inception, or maybe study settings. Maybe if it's not reflected in your model, remember that all these considerations are other things that might not really be reflected in your model that you might want to put them into your inclusion and exclusion criteria, right? And that could also be your study setting. It could be the publication status. Are you interested in preprints or original articles, published articles? It could be publication type. Are you interested in opinion articles, case studies, observational studies, editorials, commentaries, short communication? Also, language status is also another thing we consider in our inclusion and exclusion criteria, where we have to maybe we're interested in all type of studies, maybe where we use a translator to translate these studies, or maybe we're only interested in studies that are published in English or maybe French, right? So let's say we are doing a study on low and middle income countries, and let's say cervical cancer screening services in low and middle income countries. And that means we could also add GDP in our inclusion and exclusion criteria so that we can clearly define any study that we classify as either in low or middle income country. And that is where we can put these 4,500. And then maybe in our exclusion criteria, we can also have other reasons. So let's just jump into a quick example, practical, where I've formulated a gap sample worksheet for us to use in also having a more clearer understanding of what I am talking about. So this is So I'm going to make this more bold. So these are some of the examples that I've laid out here. You could have the justification, maybe if you're a PhD student and you're doing a systematic review dissertation, your supervisor might actually ask you to impute your justification of each of your models, and that's I've supported you with that in some of the examples here. And here we have our first sample question, which is the quantitative systematic review and meta-analysis of the effectiveness of physical activity in the management of depression. So here the model used is the PICO model. So let's have a look at what a detailed inclusion and exclusion criteria looks like, right? So I'm going to expand this to make it more visible. So this is exactly what we're talking about. So in this scenario here, you have the population, which are individuals who are diagnosed with depression. So remember that the question here is about depression, right? And so in the exclusion, we can exclude individuals without a diagnosis of depression or with other mental health conditions. So if you have people who are diagnosed with depression and also diagnosed with other mental health conditions, which may be co-infections or comorbidities, then we would exclude them. So here is the justification. Maybe the focus is on individuals to confirm diagnosis of depression to ensure the relevance to research questions. So I'm just going to focus on the inclusion and exclusion criteria. So for intervention, we have impact of maybe structured physical activity on depression. So here we are any study that is not focusing on physical activity, or maybe tries to focus on physical activity with other interventions like pharmacotherapy, was excluded. So for the comparison, it's just studies comparing this with other intensities of activity. So the exclusion, any studies without a comparison group was taken out. So in terms of outcome, we have studies that are reporting management of depression, reduction in depression symptoms, quality of life, adherence to physical activity program, right? So studies without relevant quantitative measures were excluded. So we also take a look at other information here, because this is where our PICO framework ends. PICO, PICO. So what are other considerations we need to also put in place? Here, it could also be design, right? So we've got randomized control trials, we've got quasi-experimental studies, control trials. So that means in our exclusion, we're taking out observational studies, cross-sectional studies, qualitative, systematic reviews, narrative reviews, commentaries, time frame studies between. So these are actually some of the information we need to get there. So for the time frame, when some studies probably from 2015 to date, maybe earlier studies here now could be earlier studies from 2015 or studies, acoustic studies, a what date. So those could also be what excluded. So for publication type, we're only interested in studies that are published. So preprints or non-peer review materials will be excluded. So for language, it's English and non-English. So let's take a look at another sample research question here, where we are talking about the prevalence of workplace violence among healthcare workers in Nigeria. So this is also another systematic quantitative review. So here, more clearly, we're interested in population, healthcare workers. So if you notice here, in terms of our exclusion criteria, we are going to exclude, remember this is the topic or the question, prevalence of workplace violence among healthcare workers in Nigeria. So that means in our exclusion criteria, we're not just excluding non-healthcare workers. We have a specific attribute of healthcare workers that we want to take out. And that is why we're going to take out any healthcare worker with less than 2 years of work experience. So in terms of our intervention, we're interested in studies that are assessing prevalence of workplace violence encompassing physical assault, verbal abuse, bullying, harassing, and other forms of. So we've got our exclusion criteria there, got studies with or without comparison group, and we've got our outcome on data on quantitative prevalence rates or trends, and any study without quantitative prevalence data is going to be taken into exclusion. And then we have our design, which is quantitative studies, cross-sectional studies, cohort studies. So exclusion criteria is clear: qualitative studies, case studies, reviews, opinion articles, all taken up. And for our study duration, only studies published from 2011 to date is going to be included. Earlier studies taken out, only English articles, original peer-reviewed studies, short communications, preprint, non-review articles will all be excluded. So we're moving on. So we move into the next sample here, where we'll have a look at another model, right? So here we will be looking at experiences and challenges faced by women with postpartum depression in assessing mental health care in Nigeria. So here, the model is the spider model. So when you look at the sample postpartum women, we've got women who are not postpartum or studies focusing on population outside Nigeria, or non-human subjects. So phenomenon of interest is on experiences and challenges. So we've got our exclusion criteria there as well. Or maybe any study that's focusing on unrelated mental health issues. So in terms of our design, we have qualitative studies such as interviews, focus groups, ethnographic studies, and case studies. Whereas quantitative, systematic reviews, mixed method studies, all removed. Evaluation, we're interested in barriers and facilitators, and studies that provide insights on personal experiences and systematic factors affecting access. So we've got our exclusion criteria there. And same with our research type is qualitative, quantitative or mixed removed. Publication type is peer-reviewed, non-peer-reviewed. Studies published in English and studies published in the last language. So the same thing also applies here, where we have our PEO framework looking at this question for impact of, we're looking at the impact of overweight and obesity on depression. Remember that the PEO framework can be used for either of qualitative or quantitative. And in this scenario, we have technically all the details that we talked about of our population, of our exposure. We have all the details of our overweight and obesity classification clearly stated with our exclusion criteria. Then we have clearly stated our outcome measures, right? And also what wouldn't really be taken in for our outcome. And remember that all these are going to be guided by your extensive review of literature, looking at what other people have done, so that you can be able to fit in a more better parameter, and also consideration of what is existing in literature. Because once you want to perform your inclusion and exclusion criteria, you need to be very clear on what is existing in the literature. So also we'll go ahead to look at only primary research articles, secondary articles / reviews, editorials, opinions, going to be taken out, only English articles, and that. So these are all the examples that we've got. And also now we will take another look at the scoping review on relationship between alcohol abuse and mental well-being among university students. So it's something that applies here about population concept and context. And we have other considerations here where we start including the design and what we don't want to include, with a clear-cut justification always at our right top end, and also our duration time frame. So it depends on how you put it in, but you just have to stick with that. So now I'm going to just have a short practice of this with our research question. So let me come up with something. So I'm going to start. So the first thing I'm going to do here is I'm going to insert table. So I'm going to call this area. So I'm going to use I'm going to call this issue. Now, for the sake of this video, I'm going to be using the PEO model, and that stands for population exposure. So having that in mind, I'm going to pick that up and I'm going to put it in my criteria. So I'm going to quickly insert that. Cool. So I'm going to also consider make other considerations. I'm going to look at design. I'm going to look at the duration. I'm going to look at I'm also going to have a look at then maybe I might want to now be specific to setting. So I'm going to only say studies. Okay. Now, let me start it from here. So I could now say maybe specifically in my exclusion criteria, I'm going to exclude studies conducted in Nigeria. Remember that Nigeria is a country that is found in sub-Saharan Africa, but I can decide to exclude it. And if I want to input my justification, I could add another. So remember, I could say anything. My justification, the reason why I'm excluding Nigeria, to enable information, detailed information. I could say, okay, to enable maybe so anything could be my justification. Remember, everything you need in research is a very good justification. Why do you want to remove it? So in this sample, I'm just giving an example. So here I'm interested in teenagers. If I could say teenagers. So that is the concept there, because I want to in my justification, I'm saying to reduce bias in the study or review by focusing only on teenagers who live with their parents, and to study the social determinants and leads to this. So it could be anything. Anything could be my justification. So yeah, maybe in my exposure, I could put pregnancy. Maybe exclusion criteria could be pregnancy at second pregnancy. So I'm not interested in determinants or maybe exploring any study that is exploring teenagers who have had could place that in mind, who have had more than one birth. So since I'm using that, I could place it in my justification. Studies that are exploring teenagers who have had more than one But so it could be just anything. My outcome, maybe I'm interested in some of those factors. Some determinants like bias, and maybe some of the emotion, whatever. So here I could exclude any sort of study. So this is to keep study focused. So my justification for including factors and determinants, just to keep the study focused on determinants. Cool. So I could come to the design. I'm going to include, in terms of my design, for my inclusion and exclusion criteria in my sample, where I'm talking about determinants of teenage pregnancy. So I could actually decide to include maybe quantitative studies, such as I could include cross-sectional studies, case, maybe I could include case studies, I could include cohort studies, I could include cities if they are present. These are all quantitative studies that we account for in our stomach, right? So also include quantitative studies. So quantitative studies covers everything. So it includes grounded theory and all that. So maybe in my exclusion criteria, any study that has a systematic review is excluded because I'm not doing an umbrella review. And then I could also exclude maybe evaluative review. Or rather than putting all this, I could say review article. So my justification is to keep cost and draw difference from primary research. Okay, so and also in my duration of medical studies conducted from 2000 to 2000, maybe 2000. Now there's something we call a living systematic review. So we need to specify the let's put 2024. Then we could say studies without a date, without a clear publication date. So yeah, the reason the justification is to ascertain recent reviews. That's why I want to include only studies that are published from within the past 24 years. To ascertain recent findings. So here, in terms of publication, I'm only interested in original peer-reviewed publications, and my exclusion criteria is going to exclude any type of preprint on publications. So a certain high quality. That's going to be my. But so, ladies and gentlemen, I've successfully generated my inclusion and exclusion criteria. So you can I see this? This is my inclusion and exclusion criteria based on my practice question, which is what are the determinants of teenage pregnancy in sub-Saharan Africa? Now we have to go back to the slides where we will have to now have a further explanation. So beautiful there. We have to now have a look at study screening. What is study screening? Somebody might ask. Now, study screening is a process of filtering studies that are identified during a literature search. So when you perform a literature search, you need to review these studies and filter them, so you can be able to choose the ones that are very relevant to your review. So this is just, how do we even screen for studies? So just like screening for studies is just like, let's say if maybe you're a guy and you're single and you want to get married. So what do? You quickly start Maybe you go to some universities anywhere in your country or anywhere, and you start collecting so much phone numbers from some females or all that, right? So what do? You start screening them. Do they meet some of the criteria you want? If they don't, then what next? If you now find some of the ones that meet, maybe by name, you might decide to now go in depth in knowing more about them, having a phone call conversation with them to know if they have what it takes to be part of your or maybe walking down the aisle with you. So now that is how do we perform that in systematic review? By screening the titles, the abstract and full text of the studies, particularly based on our inclusion criteria. That's why our inclusion criteria needs to come first. We can't perform study screening without an inclusion and exclusion criteria. So technically, for us to be able to do our inclusion and exclusion criteria, it means that we have our study screening ahead in mind. So what are the steps here? It's very simple. Just imagine a baby who you've asked the baby to select the red balls out of a bag that is filled up with so many colors of football. And the first thing you need to do is you need to check the title and abstract. And let's assume this is just the first thing you need to do, particularly. Right? Because you don't really want to start looking at things that are irrelevant. You just want to focus on the keywords that match your inclusion and exclusion criteria. So let's assume we're looking at a study. We just searched online, what is the impact of diet on management of type 2 diabetes? This is our research question, our topic. So in that situation, some of the words that we're interested in is anything diet, nutrition, type 2 diabetes, blood sugar. So when we start seeing a title of any study that has type 1 diabetes, maybe children, animal studies, things that are unrelated, maybe cancer, whatever, we immediately exclude them in our title and what? Abstract screening immediately. Then what is the next stage is what we call the full text. After we might have been done with the title and abstract screening, we look at the full text. How do we look at the full text? We look at the full text by checking thoroughly evaluating the methodologies, paying close attention to some of the models that we've identified in our inclusion and exclusion criteria. Does it fit in the population? Does it fit in the intervention? Are the outcomes clearly described? So we're also going to have a thorough look at that in this session. Now, for example, so let's say you want to find a study that investigates the effect of diet, but only in the population now you're seeing type 1 diabetes. So that study you're definitely going to include it, just like we talked about before here. So let's say you now open the full text of this now. After writing type 2 diabetes, and you start finding out that it's type 1 diabetes is inside it. That means you're definitely going to do what excluded. Then another next step we will now do now is where we now apply our inclusion and exclusion criteria. Right. So it's technically in the full text because then we now have to look out for our inclusion and exclusion criteria to be sure if everything that is in our inclusion and exclusion criteria is what that it's clearly documented in that study before we can make our final decision if we're going to include or exclude them. So an example is that if we're looking at studies that are actually focusing on type 2 diabetes, like these diets that we talked about, right? So if we now start looking at them, so that means we're definitely, if we start looking at the study based on applying our inclusion and exclusion criteria or what we used to call our eligibility criteria, then it now means that we need to, the studies that are without control groups, maybe we'll be focusing on children, animal studies, when we now look at the full text, and maybe not reporting the keywords like blood sugar control, maybe when we open the full PDF of the article of the study, then we will have to do what? Exclude it. By then we should have clearly applied it to our inclusion and exclusion criteria. So if you look at our future session, the Prisma diagram is what we use in recording, and we're going to have a snapshot of that practical right away for our study selection. And the components is still the same. We identify the number of records, identify through the databases. Then we have to check out the number of records screened with reasons for exclusion. Then so that means here we're going to put in here, then we take out duplicates, then we'll check out our screening, then we are going to also exclude studies that maybe that doesn't really meet what we want to screen on. Then in terms of our eligibility, when we look at the full text eligibility screening, is a full text screening. We now have to now make the reason. Maybe conducted in Africa, maybe not conducted in Sub-Saharan Africa, like we use in our example, and lots of things that we've got to put into consideration. And also, again, we now have our total inclusion in our review. And then we also need to know what is going to definitely lead to meta-analysis in that case. So all these things are technically going to be recorded on our Prisma flow diagram. So let's have a more simpler example of what our study selection process is going to look like. Because, for example, now, impact of diet on the management of type 2 diabetes, just like we said. Remember that step one, again, I'm just going to give this rundown, is title screening, right? So let's say we found the paper, and this paper is titled Nutritional Guidelines and Their Effect on Type 1 and Type 2 Diabetes. Now, in our decision here, we have to exclude it because it's focusing on both type of diabetes, but our research here is only interested in type 2 diabetes. So the decision is to do what? Exclude. And let's say we saw another article and it's saying the role of Mediterranean diet in managing blood sugar in adults with type 2 diabetes. Decision is to include because it's relevant to our population and it focuses on diet. And again, let's say we are now looking at another article when we now open the full text. And the title is talking about the effect of low carbohydrate diet on blood glucose in adults with type 2 diabetes. Our decision is going to be to include it because the intervention, low carb and population that are adults with type 2 diabetes fits our inclusion criteria. But let's assume we have dietary supplements and their impact on children. So definitely going to exclude, which is something that we said. And again, we need to use our detailed checklist of our exclusion criteria and inclusion to check out specific points. Maybe if we're including only randomized trials, observational studies, maybe we've got specific participant group, that we've got of interest, then this could actually inform our exclusion, maybe probably our inclusion. So here brings us to the practicals, where we will talk about the duplication process and technically everything we need to know to get started. Remember, I'm just going to show us a couple of examples and practice sessions for us to be able to know how to perform our deduplication and removing undesirable search results. So our deduplication is just the process of removing duplicates. So we wouldn't want to have, well, let's say, for example, a study known as Innocent et al. 2024. We wouldn't want to have two of those studies on the same topic in the same pool. That means we're definitely going to exclude these papers because if we don't put them into exclusion, if we don't deduplicate them, remove the duplicate, then we're going to have so many things. So, and one of the benefits is that it just helps us to keep track of accuracy and efficiency. It streamlines everything and it makes it transparent and accurate. So I'm going to introduce us to a software, magnificent software that we call the Zotero. And Zotero is just a free and open source tool that helps researchers to manage their references, because for you to perform your study screening, you need to also learn how to manage your references using Zotero. I've already taught us how to use Covidence in our previous session, and in this scenario, you have to understand how to use a reference manager like Zotero. We've also got other ones like RefWorks, Mendeley, EndNote, and lots of them that we also use in deduplication. But I'm going to show us how we can use Zotero for deduplication, how we can import citations from databases like PubMed, Google Scholar, Scopus. I'm going to show us hands-on examples on how we can do it, because this is the reason why we use it, because it helps us to detect duplicate entries and makes it easier for us to clean our data set. So I'm going to show us how we can install Zotero and how we can use it to get started in filtering out our duplicates. and also how we can integrate it into a Word document writing. So here is just an example of it. So when we import, when we download Zotero, the next thing we need to do is to import some of those search results from those different databases. And the next thing we need to now do when we import it, some of the databases could be PubMed, it could be Shinal, Google Scholar, Scopus. And we'll go to File, we'll click on Import, and select the files we've imported. It will now display all the imported articles in our collection. Then we'll have to identify the duplicate records automatically, detects potential duplicates based on the title, author, year, and we go to the duplication item folder in Zotero's left sidebar. We remove the duplicates, we merge them because we need to now count them. Remember that in our Prisma, we now need to quickly record these duplicates before we move to the title and abstract screening. And then once we are satisfied, we merge them and before we can export. So an example now is that, let's say, for example, we want to export maybe items away from our Zotero, but then how do we start? So we perform search on PubMed and Google Scholar. Let's say we've exported 25 articles each. And both of these databases cover some of these overlapping research. So it's possible that, let's say, for example, an article on prevalence of diabetes in PubMed can also be found on Google Scholar. So after we've imported these databases, then we have to now merge them together because they are the same. We found it in Google Scholar and we also found it in PubMed, and we imported them together. So that means we need to remove the duplicates. And so what Zotero will do is it's going to merge these items, and then we're able to count the number of duplicates that are found from PubMed and Google Scholar. And we'll be able to now do that. So I'm also just going to talk about another item we need to use, which is going to be the Excel, where we'll perform our screening, because our screening usually takes place in Excel. Excel is a very beautiful user-friendly tool that we can also use in performing screening in systematic reviews. Remember, in our last session, we talked about how you can collaboratively use softwares like Covidence. We also have another software that we know as the Ryan software that we use in performing our screening, and it just allows us to organize, sort, and track, and also filter out undesirable characteristics from our papers. So some of these tracking here is for our inclusion and exclusion criteria. We record the reasons for exclusion of studies, and it also helps us to collaborate with team members by sharing some of our information with the sheet. And it's easy to sort and filter studies to manage large data sets. So how are we going to use our Excel for performing our study screening? We are going to demonstrate that in a practical. We've got studies exported from Zotero to Excel, and maybe we've got it's got the title, it's got the abstract. Then we're going to create another column where we can, decide if we're going to include the study or we're not going to exclude it. After then, we'll now need to look at our reason for exclusion, and we can know how to include our or maybe extract the full text of the papers and also make additional notes. So we're also going to make all these explanations. So this is what it looks like in Excel when we have the study ID, we have the title, we've got the abstract, so we know whether we're going to include or exclude it, and the reasons for exclusion, which is going to be noted because we have to gather all this information and record it on the Prisma flow diagram, and also note some of the population. So we've got some other couple of practice exercises for us to do. But before we jump into that, let's jump into how to install Zotero. So how to install Zotero, immediately come here. The first thing you're going to do online is to click on search Zotero download. Right? So immediately you click on Zotero download. I'm using Firefox and I'm using Windows. If you're Mac, you can actually search that on Mac. And if you're using Linux, you can also equally search that. So you click on this. Now the next thing you need to do is to, whether you're using your Chrome or you're using the Firefox, you would, after downloading your Zotero, you need to download a connector. right? So the Zotero connector is what that is going to actually help in linking and syncing the citations you get from from the web or from whatever search engine that you're searching from down to your Zotero app. So I already have Zotero installed here, but then what I'm going to do, I'm going to show you how to download it. So on your PC, if you're using a 32-bit PC, you can just click on it, but I'm just going to click on that to download it, and then I'm going to let it run. If you're using a Chrome extension, you also have the Zotero connector there. I'm going to quickly open that. So you're going to search Zotero download, search that, and you're going to get that. So you click on that as well. So if you notice here, this is my Zotero connector for my Firefox, and this is my Zotero connector for my Chrome. So this is the Chrome connector, and whereas that also is the Firefox connector. So I'm done downloading it. So the next thing I'm going to do, I'm going to install. How do I install? I'm going to install by coming here. So I have a message pop out there for me to verify if I'm going to install. So it's extracting. So I'm going to let that run. So if you're using your Chrome as well, you also need to do the same thing and also install your connector. So now, if I want to go ahead to install this, I'm going to click on yes. Now, it has 2-bit version of this is already installed. So, but if I want to replace this now, I could go ahead by clicking OK. So I could go on next, 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 install. So I'm going to wait for that to run. I'm waiting. So that's running. Wow. So while that is running, so if I click on finish, it is going to reboot, but I don't want that. So, but this is already my Zotero here installed, and I have all my files here. Remember, you have to install the connector. Remember, you have to do what? You have to do what? Install the connector. That is very, very what? Very, very important for you. So what am I going to do? Now, what we're going to do next now is to hit up our search term from here, so we can now try to see how we can use Zotero to perform our search and screening. How we can use Zotero to perform our study screening. So if you look at this, my file here, I already have Zotero installed, and I already have so many references saved from several folders, because technically when I'm writing on my Word document and I want to acknowledge or cite any statement, I will usually have to refer back to any of these files and pick up the information that I'm interested in. But now in this video, I'm going to be more focused on how we can actually import new items to my Zotero, and that's it. So let's assume I've got my keyword search here. So quickly, I'm going to come here. So I'm going to close this. I'm going to come here. I'm going to open PubMed. So let's go to advanced. Okay, so clear all. So without wasting much of our time, we'll come here quickly. So I'm going to pick up my search strategy. Cool. So I'm going to pick up this. Remember, So I'll put this. So add that to history. That's the first one. Remember that we're working on our title, which is determinants of teenage pregnancy in sub-Saharan Africa. Now I'm also going to bring the Prisma flow diagram, a sample of the Prisma flow diagram, to also make it more interesting for us. So I have just saved a fresh Prisma flow diagram. I'm going to place it here to show us how we can also record our search results. So quickly, I'm just going to jump down here. So cool. So we're good to go. So now what we are doing technically now is we are trying to put in all the search terms for this so we can actually get the results and quickly start our screening. So I'll come here. I've put that for one teenage. I'm going to take the second one. So I'm going to quickly come here. I'm going to just hover around here. So I'll add to history. So that's my second hit. So I'll move to the third one. Remember, I'm interested in sub-Saharan Africa. And I excluded Nigeria. So I'm going to take out Nigeria when I put in my search term. So, but for now, I'm going to leave it for the sake of this video because we already know the essence of that. I'm going to come next to the fourth joining type, which we are interested in determinants. I will combine its influences, and so I'm going to add that. Cool. So now to perform my search, remember, the next thing I'm going to do here is I'm not going to now combine it with the AND Boolean operator. And if you can remember back in our previous video, we made it very clear that the AND Boolean operator is used in joining spelling variants that are in different, or maybe we want to join words that are in different spelling variants. So determinants, sub-Saharan Africa, pregnancy, and teenagers are all in different spelling variants. So we join them with the AND Boolean operator, but we use the OR to join words that are within the same spelling variant. So when you look at all the words, synonyms of or mesh terms or tie-up terms of determinants, they're all separated by the OR Boolean operator. So in that case, what am I going to do? I'm now going to come here to now click #1 and #2, #3, and #4. I could have just done that easily by copying this here and placing it there. But since I already have that sorted out already, I will come and hover around here and click on Add to History. Now, I have 4,185 results. Now, I'm going to click on that to have a look on that. Now, these are the papers, right? Now, if you remember in our previous session, when we talked about managing search results, we talked about the use of search filters. Here we said exclusion. And when you look at my inclusion and exclusion criteria here, it was already clearly stated that I'm going to include quantitative studies and I'm going to include qualitative studies, as well as observational studies and all that. But I'm not going to be interested in what systematic reviews and all that. And I also made it clear that I'm only interested in studies that are conducted between 2000 to 2024. I'm only interested in peer-reviewed publications. So in that scenario, I'm going to apply that to my search results here. So what will I do? For the case of this video, we're using PubMed. I'm going to come here, I'm going to click on this. I'm interested in this. It goes down. I'm also interested in clinical trial. Goes up. I'm also interested in randomized control trial. Still stays up. I'm only interested in human species. spacing. I'm only interested in studies that are conducted between 2000 of 01, January of 01, down to 2024 of the time of this video is, maybe I could leave it at 2024, right? And I click on apply. Now, is there anything we're missing out? We're only interested in English, because if you look at this part of it, okay, yeah, we have added that language studies published in English. So this is the language, our language specification. Okay, so we've added that. So we click on English, and it comes down from 155 to 138. So this is, we are good to go. But if remember, we said in our that we're going to exclude preprints. So that means we're also going to come here, hover around there, and click on exclude preprint. It's mentioned. So now, if we also have focus about additional filters, we've got other additional filters that we can also add. Maybe we're interested in other things that we really need to study. Maybe it could be based on species, maybe it could be on language, we chose English already, on sex, it could be based on age. Are we interested in adults or this? But in this situation, we're mostly interested in adolescents. So, but let's check that box for adolescents, and also check this box for young adults, and also check this box, right? So we show that, so we check it. So could really be for adolescents? That's fine. So let's check for adults too, for young adults. So that's cool. So we have all our filters well sorted out. Now, what's the next thing? What next are we going to do? The next thing we're going to do is to save it. So we click on save, we click on this. Now, for the sake of this video, we're going to save it as a what? We're going to save it as a what? PubMed file, right? So we click all the results. We're interested in all the results. So we click on what? Create file. Now, we have that sorted out. Now, let's assume we're also using another database known as what? Google Scholar. Okay, so we search it. So we come here, and let's come to our Prisma flow diagram. Remember, make sure you're following. In our Prisma here, we will now see for PubMed, we have 137. So we found what? 137. So we're also going to include another one, which is what? Google Scholar. And it equals to. Now let's assume we want to put our search term here. We want to narrow it down, because most times, most of all these search strings are not usually recognized in all the databases. We already explained that in previous video. But what do? Let's combine it in a text format. So I could start that quickly. I pick the first time. Place it here. So we'll pick up the next term. Got it. Oh, sorry. We should be separating with the and operator, not the and. So this is adolescent ended here. So let me color that yellow. Pregnancy. So this is searching with our full terms. Okay, so we'll move to the next. Let's do this. I'll take that. So this is our textual search strategy. So we'll just put it on Google Scholar and see. Okay, cool. Wants to know if I'm not a robot. I'm gonna do that. Bridges. This. Cool. Okay. Okay. Okay, cool. So this is what we'll do. We'll just encounter that. So let me make it simple because it doesn't, what it means is it doesn't recognize this. So we'll make it this, we'll remove the strings. So this is for free text terms and pregnancy. Take out this. Call this relevant. So let's keep it simple for the sake of this video. I'll take this out. Okay, cool. Okay. So let's put this. So yeah, we've got the search down. Cool. Fine. Now, what I want us to do is now for you to screen for articles here in your from Google Scholar, what you just need to do is simple. You could just click on save. Now I'm going to create another folder for this, but I've already created a folder. So when you click on save, so let me start it again. Manage. I'm gonna delete. So I'm gonna delete that. Okay, cool. So this is our. So when you click on save, you create a new folder. That folder could be called image pregnancy. Okay. So save. So let's say click on this, you save. You click on this, you save. You have to read the articles. You're not even interested in this already. You saw it, systematic review. You click on this, you save. On this. So I'm just going to use this quick for an example, and click on this. So you could save up so much loads of bibliography on your. So you can save up loads of bibliography for your references, and yeah, so go do away with this. So you click on my library, come here, teenage pregnancy, you click on it, export all. You export as refman. So you click on refman, you export all articles with this label, not only the ones on the page. So you want to also include all the ones that came in the second page. So you click on this, you export, and immediately saved there. Now what do? We come to Zotero, so you open the software, Zotero app. So I'm going to assume I don't have any reference here. I'm going to search for teenage to be sure I don't have it. Okay, cool, I don't. So what do you do next? You come to Zotero, you click on file, you click on new. When you click on file, you click on import. Now, if you've got this, you click on next. If you're importing from Google Scholar, you come to downloads, and this is it. Now, but let's start with this. Whichever one, maybe we'll start with this, we just download this. So click on next, and it's imported. All your files are imported. Now, if you still want to import more files there, you still have to click on file, import, next. You click on PubMed, you click on next. So it's important. So while it has Google Scholar, when I checked out from Google Scholar, there was no avenue for me to perform screening or filter some of the papers in Google Scholar, contrary to what I did in PubMed when it was easier for me to put in my filter, apply filter for the year, apply filter for adolescent group, apply filter for other groups that I found very interesting. Right. I remember here in this paper, 19, the idea of putting 19 to 24 was because of 19. Right? Cool. So what do? I return back to Excel here. So what are we going to do now? Now we have the study authors, which we might not really be interested in, but we're more interested in the title. So I'm going to check out this. I'm going to check out this. So I'm going to rename this as reason or decision. So this is going to be my decision. Now remember back then in the slide, when I did explain to us that here, for you to perform your study screening using Excel, we're talking about Excel, you have the title, and you have to look at the title to see if the title contains some of the keywords that are of interest to you, then you're going to make your decision whether you're going to include or exclude. And then also, if you are definitely going to include it, then you're also going to look at the abstract to know if it's still something that you're going to include or exclude. So that's the same thing we're going to apply here. So yeah, being our decision. So we take a look at this first article, pregnancy determinants among women in Africa. So that aligns with our inclusion criteria, with our title, and also reflects we're going to include. Then, okay, I could check out this. Maybe I could remove this as well. Maybe I'm not interested in this. I'm going to expand my decision. Also going to expand it here so that I can be able to make my decision, right? So I'm going to rename this. Maybe I'm going to rename this as reason in this case, for the case of this example. Now, when I go to my second title, this is determinants of adolescent pregnancy in sub-Saharan Africa, a systematic review. Now, remember when we return back to our inclusion and exclusion criteria, we made it clear that we are not going to include review articles in our design. We said that we're going to exclude them. Remember, this is what we said in our exclusion criteria. So that means what I'm going to do is I'm going to now come here. I'm going to come to, since already in the exclusion criteria, systematic reviews are not going to be pertinent for me. So I'm going to come here and make my decision here is to exclude. So I move on to the next. Factors associated with teenage pregnancy in sub-Saharan Africa, a multi-country study. What do you think is going to be our decision? Could you give me 1 minute to think? Good. Yes, I know what was your mind, so we're going to include. Now, the next thing is we're going to come to this case, the adolescent pregnancy, sub-Saharan Africa, a cause for concern. Now, we're still going to include. Why? Because we will still need to see the abstract of this paper. Now, remember, all the abstract of this paper are all, ideal to be displayed at this very, part of it. Because when you go down, you realize that all the abstract of the papers has to be displayed. So in that situation, what we are saying now is, this is what we will continue doing. We still come here, we look at this part of it, we either include. When we look at also this part of it, we exclude. Maybe we will make all these decisions pending when we've reviewed the title, like this is talking about mobile messages, and we're not interested in this, so we're going to exclude, right? So for all the titles that we are going to include, we will now have to now go down by viewing the abstracts to now check if the abstracts contains the necessary information that we're interested in. And that is where, when we now come to our Prisma flow diagram, we will now say that we excluded, for the ones that had the wrong title abstract, for example, we excluded 100. And then when we now had our full text eligibility screening, for example, then maybe we had 53, it resulted to 53. And how do we now get our full text? So to get our full text, we need to now retrace it from the DOI link and download the full text of the papers, then check out if they still address in details what we have clearly stated in our inclusion and exclusion criteria. So this is actually a very simple way that you can actually use the Excel spreadsheet to perform your study screening. And in this scenario, you can actually share it with your collaborators or people who are actually also involved in performing the same or similar research with you, and you guys can actually go through it, judge all the papers, to look at all the abstracts. You click on it. These are all the abstracts of the papers, all found. In the situation whereby you didn't find the abstracts, then you have to keep the study aside to also have a more detailed look at it. This is the abstract being extracted, and that way, when you've now gone through the full text of the papers, let's say for example, we've now examined full text of the papers, and maybe in terms of country, some of them were not in Africa. Maybe let's say n equals to 20, and maybe we're also in another reason that might be excluded, maybe publication date. For example, let's say n equals to 13. For example, these are all examples I'm giving, because when you hover around your Excel sheet here, maybe you might find some papers that were published earlier than 2000. And in that situation, you have to do what? Exclude them. Remember, this is an example that we're putting in here. And maybe studies that were not really focused on, or maybe they didn't fall in line with your design. Remember that in your design here, maybe you might have checked out the studies, and after having a very good title, Conducting Africa, they were narrative reviews or stuff, and you were not able to spot that in the title and abstract, but you spotted it in the full text. Then you have to come down to your Prisma and record. So at the end of it, let's say you've now excluded, maybe you've got other reasons for exclusion and it was to 10, right? Then you now have total of 10 studies, which is going to be suitable for your review. Now, you might ask, how about the meta-analysis? So the meta-analysis, we're going to also discuss that in details. Meta-analysis are when the studies now have homogeneous outcomes, right? So if the studies in details now might be suitable for you to perform a more detailed statistical analysis, then you have to now review them and know if there is not going to include them. Because situation, when you're performing your review, you can have 10 studies that has met your inclusion criteria, and they have now fitted for your review, for narrative synthesis or for your systematic review. But when you want to have perform statistical analysis, you now have to pick out the quantitative study. Maybe it could be 7 or whatever. And that is how you now have your screening well recorded. Remember that we can use diverse applications to perform our study screening. We can use the Ryan tool, we can use the Covidence, we can use this Excel sheet. And the idea behind all these tools is that while you're using them, they are recording your results. They are recording every decision that you're making literally while you're screening the papers. So you have to record them. Tools like Covidence automatically records it for you. Whereas in Excel, you have to sometimes manually to make your input and record your decision. Remember that the idea for you to record it is for it to be reproducible, so that when the reviewer or whoever deems it fit that is critiquing or reviewing your article goes through it, the person can be able to understand that, yeah, these were the reasons why your study was excluded, or while you arrived at a certain number of papers for your review. So with that on the run, we could now say, yes, that we've now had an understanding of what a systematic review looks like, and also what the study screening in a systematic review seems to be. So we're going to have a rundown of what we've just explained in this session, where we looked at what's inclusion and exclusion criteria. We also understood why IEC, why inclusion and exclusion criteria, which can also be referred to as eligibility criteria, is necessary for systematic reviews. How we can develop our inclusion and exclusion criteria using several models, and also some of other considerations that are very important for us in performing our inclusion and exclusion criteria. And then we also took a look at some of the steps in performing our study screening. These are actually very important, and also how we can record on the Prisma flowchart using Zotero and Excel. So we started by looking at inclusion criteria and some of those specific attributes and characteristics of your study participant or your study that the study has to meet before you include it. So this is just like what determines that the study has to be relevant to be included in your pool, right? Or in your pool of evidence. Why exclusion criteria could be those specific characteristics that you might not really be interested in. And that means some of the studies could possess that you have to disqualify them. And looking at this example here, in the study on the effect of physical activity on reducing the risk of cardiovascular diseases, the inclusion criteria might be studies on adults aged 40 to 65. Remember that this 40 to 65 isn't clearly stated in the example, but then we clearly made it very clear that this is what we are going to be looking at, and then we are going to omit studies that maybe focuses on pediatric population or maybe other attributes that might not really be of interest to us. And we looked at the reason for performing a systematic review as for performing an inclusion and exclusion criteria in a systematic review. It has to have focus, transparent, it has to reduce bias, efficient, and reproducible. And then we went further to look at some of the models like the PICO model, where we had a very detailed example. Look at the example here. And also look at the SPIDER model, SPIDER framework. We had a look at some of our also very good examples, as well as the PEO, which means the population exposure and outcome. And we've got some other examples which we also looked at the PCC and its own example, where we clearly stated that the PCC in its inclusion and exclusion criteria is mostly in scoping reviews. And we had an example for that as well, and for the PEO. Now, we also looked at other considerations too, where we talked about dates, study setting, status, type, language, GDP, and a lot of other things as well in this course session. And that was where we started by showing an example of our spread worksheet, where we showed some of the examples from a research question of a quantitative semantic review and meta-analysis of effectiveness of physical activity in the management of depression, where we had a clear look of what the inclusion and exclusion criteria could be, which is also referred to as the eligibility criteria. So we had that example again for workplace violence among healthcare workers. We really explored the prevalence and had a look at sample systematic review. Also, we did that for the spider model, and also had that for the PEO framework, where we looked at the question on the impact of overweight and obesity and depression among the adult population in the UK. We didn't also stop there. We also looked at alcohol abuse and mental well-being of university students in the UK. We looked at the relationship, and being a scoping review, we had a look at what the inclusion and exclusion criteria, which is the eligibility criteria, could be. And as well as our practice question there, where we had a very detailed comparison of this and what our justification could also be, particularly if you're looking at this from your PhD dissertation. Then also we went further to talk about study screening, where we explained study screening as reviewing and filtering studies and identified during any literature search, which is something we would also always get in common with the systematic review, because study screening spans from the title to the abstract check and to the full text check. So we also examined some of the step-by-step guide to this study screening. We looked at what it could be. We had examples. You have to check out some of the keywords in your search terms, and understand when it's not going to be included. And also, we had a look at some of the other domains of it, which is the application of the inclusion and exclusion criteria. We looked at the Prisma flow diagram and also other examples for full text screening before we talk about the duplication. Our practical example using the Zotero and the Excel sheet to spot duplicates. We also showed how we can perform our search and export it to Zotero for our screening, and also move it from Zotero to Excel. And we also demonstrated how we could use the Excel sheet to screen for types and abstract, and also record the reasons, which is also something that is very paramount, because recording our reasons is very important for us to document on our Prisma flow chart. And then that is it. So we've got exercises for us. Looking at this, we need to start by creating an Excel sheet. You have to import a couple of articles with your question, and get these things done. They are very important. Also got another exercise where you can apply the inclusion and exclusion criteria to any desired question. You can use the PICO, which I've said here, but you can also use any other model that might be very interesting to you, and collaboration, which is a very paramount aspect of this research. So in our next session, we're going to be looking at how you can understand your study selection properly and your bias in study selection. So it's a pleasure to have each and every one of you in this session. So thank you very much for keeping up.